Mood naturally fluctuates, and every individual experiences the highs and lows of life. Though negative moods and anxiety can be advantageous in motivating positive change and growth, when experienced in excess, these feelings may lead to chronic, debilitating feelings of worthlessness and apathy that can in turn cause impairment and dysfunction. In this case, it is likely that important activities, such as maintaining a job or engaging in interpersonal relationships, will become increasingly difficult, if not impossible. These severe disturbances in emotionality and functioning are often linked to depression, which affects millions of people and can lead to tragic consequences if not properly treated. The proper diagnostic term for depression is Major Depressive Disorder, which is a mood disorder characterized by several symptoms: low mood, loss of energy, changes in appetite, feelings of worthlessness, excessive guilt and lack of motivation, poor concentration, and finally, loss of interest in once pleasurable activities known as anhedonia. Individuals with severe depression may also experience persistent thoughts of suicide. Based on diagnostic criteria, an individual with at least 5 of these symptoms qualifies for diagnosis of depression. The integrative theory of the etiology of depression combines biological, psychological, and social dimensions to explain the factors that lead to depression. Although depression is a mental disorder, it is important to note that it has strong biological influences and physical manifestations within the brain. For years, the development of depression has been associated with low levels of serotonin, a neurotransmitter largely involved in regulating mood and behavior. Although some patients benefit from medications that boost serotonin levels, it has recently been theorized that the balance of neurotransmitters in relation to one another is more important than their independent levels. The endocrine system is also implicated in the etiology of depression. Research has suggested that the hypothalamic pituitary adrenocortical or HPA axis, which coordinates the endocrine system and produces the stress hormone cortisol, is overactive in depressed individuals. According to Barlow and colleagues, chronic stress and the oversecretion of cortisol leads to hippocampal atrophy and decreases plasticity. The hippocampus, involved in regulating stress hormones, memory, and emotion, has noticeably lower volume in people with depression and is thought to be negatively affected by stress prior to the disorder. But to what extent is depression inherited? Many family and twin studies have proven that depression is heritable, and Kenneth Kindler, a leading psychiatrist in the study of genetics, suggests that this heritability is equal in men and women. Lastly, the serotonin transporter gene, 5-HTT, has proven to be correlated with biological vulnerability to depression. In 2003, Caspi found that people with 1 or 2 copies of the short allele were particularly prone to develop depression following stressful life events. These findings have been corroborated by Kaufman, who found that the prevalence of depression was higher in maltreated children with 2 short alleles. Psychological factors such as stress are also considered in the integrative theory of etiology. Notably, though, not everyone that experiences major life stress becomes depressed. One explanation of this is that the context and impact of stressful life events vary from person to person and will therefore not affect everyone to the same degree. Kindler and Hetema have also suggested that the type of stress is an indicator of its subsequent effect. In a classic twin study, the researchers blindly rated participants on humiliation, entrapment, loss, and danger dimensions and examined them for major depression. Results suggested that the disorder is predicted by high rates of loss and humiliation, but not by entrapment and danger. The learned helplessness theory of depression, developed by Martin Seligman, theorizes that people become depressed when they believe that their circumstances are uncontrollable. Further research has suggested that negative attributional style increases psychological vulnerability to depression in individuals who experience negative events during childhood. In relation to this, eminent psychiatrist Aaron Beck has suggested that negative cognitive styles are involved in the development of depression. Specifically, he has noted the tendency of depressed individuals to make cognitive errors in 3 main areas: the self, the world, and one's future, and to develop negative schemas following exposure to recurrent stressors. Depression is also strongly influenced by social interactions and interpersonal stress. It has been shown that as many as 70% of individuals with major depressive disorder are female, leading to further inquiry about the role of gender in depression. Interestingly, women are historically viewed as subordinate and weak in relation to men, which may lead to a sense of uncontrollability that in turn increases hopelessness. Women, as stereotypical caretakers, are also taught to highly value interpersonal relationships and may therefore be more strongly impacted by the deterioration of a marriage or a close friendship. Lastly, level of social support is an important consideration in the development of depression. A recent literature review by Osbey and colleagues suggests that social support may increase resilience to stress by moderating genetic and environmental vulnerabilities. Therefore, when an individual has inadequate social support, he or she may be less likely to properly cope with stress and therefore be increasingly prone to hippocampal atrophy and decline of neurogenesis. In addition to the aspects that lead to depression, there are also notable factors that may serve to maintain it. Depression is both unique and troubling in that many of its causes also serve as maintenance factors. Firstly, the shrinkage of the hippocampus is of primary concern. Because the hippocampus partially serves to regulate stress hormones, its deterioration inevitably increases the hormone cortisol, and in doing so increases risk for further hippocampal atrophy. Because hippocampal atrophy is correlated with decreased neurogenesis, we must consider the importance of this process in relation to recovery. Glasper and colleagues have concluded through literature review that new neurons are associated with improved learning and reduced anxiety, so it is possible that the slowing of neurogenesis in depressed patients may impair their abilities to correct cognitive errors and manage stress and anxiety. Major life stressors may also serve to worsen depression both biologically and psychologically. As depressed individuals are inundated with stress, the hormone cortisol is elevated and contributes to further atrophy of the hippocampus and decreased ability to regenerate new, healthy neurons, as suggested by David Barlow. Psychologically, chronic stress likely reinforces a depressed individual's negative schema and in turn strengthens their sense of hopelessness. Because some individuals form negative cognitive schemas at a young age, as Beck claims, automatic negative associations may serve to perpetuate depression. Without proper correction, cognitive errors and negative associations will continue to impede a person's ability to find hope and happiness. Lastly, a lack of social support in a depressed person's life may lead to an inability to cope with and manage stress. This only further worsens the cycle between the biological effects of stress and the psychological factors that maintain it. Depression may have an insidious onset in cases where symptoms precede and contribute to the generation of stress, as suggested by Heyman. People may also experience only one bout of depression, although this is rare and depressive episodes are typically recurrent and chronic. Extensive research on effective treatments for major depressive disorder has emphasized the potential of both biologically based and psychologically based treatments. Antidepressants are a class of medications used in part to repair the physical consequences of depression. Of the antidepressants, selective serotonin reuptake inhibitors, or SSRIs, have proven to be the most effective in treating depression without the severe side effects that accompany monoamine oxidase inhibitors or the danger of tricyclic antidepressants, which are lethal if taken in excess. SSRIs work by blocking the presynaptic reuptake of serotonin, temporarily increasing its levels and therefore rebalancing neurotransmission. Because a decrease in neurogenesis is so strongly implicated in the cause of depression, psychologists such as Jessica Malberg suspect the antidepressants actually serve to reinvigorate the proliferation of new neurons. Despite suspicions about possible placebo effects, Arl and colleagues have found substantial evidence that SSRIs and tricyclic antidepressants are more effective than placebos in both psychiatric and primary care settings. If antidepressants prove ineffective, patients may begin electroconvulsive therapy, which uses electrical impulses to produce seizures. Though these seizures may cause temporary and, in some cases, permanent memory loss, ECT has been proven to increase serotonin levels, decrease stress hormones, and promote neurogenesis. Transcranial magnetic stimulation is also used to treat depression by altering electrical activity in the brain, but this method is less effective than ECT. On the other hand, psychological treatments tend to be more focused on cognition and behavior and are scientifically proven to be the most effective long-term treatment. Cognitive behavioral therapy, or CBT, is based on Aaron Beck's theory of cognitive errors. This family of therapies therefore focuses on redirecting negativity and correcting maladaptive thinking in order to reduce depressive symptoms and prevent recurrences. According to Ellen Dreisen, CBT has in fact proven to protect against the relapse of depression. Interpersonal psychotherapy is another psychological treatment and is instead based on the proven importance of social support. In IPT, patients are taught skills to resolve interpersonal conflicts and build new relationships, all while current interpersonal problems are worked through and resolved. Evidence suggesting the efficacy of IPT dates back to 1970 when Klerman and Wiseman first developed it. Lastly, it has been proven that at-risk children and adolescents benefit from learning proper cognitive and social skills before puberty, and that in families with more than one depressed individual, family therapy may be necessary for improvement. Because depression is such a prevalent disorder, future research should be aimed at identifying the most effective preventative measures and determining ways to institute them time and cost efficiently. The restoration of neurogenesis should also be emphasized, and researchers should consider the possibility of cognitive-based therapies that promote this process in order to avoid the negative side effects of medications.